Hey Ruben, great
Oh.
to see you again.
Good to see you.
It's been what? 3 years now we've seen? I saw you on the
years?
3rd year, then the 2nd year I missed a year. And now
Oh,
I'm
that
back.
we meet, yes, I think we've been meeting for 3 years now.
Yes, and now I hear you're not in the emergency room
I'm
anymore?
not in the emergency room.
Oh, my
But that's
word.
just was just some 30 years of my life, so.
What I would like to do today is to tell you a couple of stories. And then I would like to hear your take on it.
Okay.
All right. Now, you know, I'm a nurse in an emergency room, and I came here mainly to teach you folks, or to talk to you, not teach you, about healthcare violence and how we in the States were getting kind of battered. And every time I turned around here, there was security right behind me. And I was absolutely amazed. I go into the ER and I chat with all your nurses, which you were very kind to set up that. Twice you set it up. And so I'm going to run through some of the things that happened to us. Okay? Gentleman comes in by EMS. Okay, now EMS kind of tied his hands, very soft restraint, not really restrained, but so that he wasn't touching the equipment. We put him on the stretcher, we retie his hands just to make sure that he doesn't flip out, okay? He's a tad intoxicated by the alcohol in his breath and his speech. And before we know it, somebody says to us, there's a fire. And we went, what? Well, this little guy, and he was little, scooched down, took a lighter out of his pocket, and set the soft restraints on fire. Sparks are flying, and one of the nurses got hurt. She got a corneal abrasion from the sparks. Another girl, a nurse, she went into a room. She kind of had an idea about this patient. She came out of the room walking backwards, as we're taught in our 1st year of nursing. The minute she turned her back, that woman, so fast, jumped her, had her thighs on her hips. Took 7 people to get that patient off the nurse's back. Another one is a male nurse, like yourself, walks into a room. The patient bites him. He didn't think too much about it, washed it all up, and he was tough and ready, and I can see that you two could be twins.
Yeah.
Before he knows it, there's a huge infection in his finger.
Sure. Man.
There's another one. She was caught behind a stretcher, and she's in her 60s. 22-year-old, got one leg free and hit her shoulder so much she needed surgery. Another nurse, she goes in. Fella had an argument at home. We brought him to our very last room, the trauma room, to make sure that he was taken care of. She went like this to put the blood pressure cuff on him, and he wham, knocked her right onto a cabinet. She was out for like 4 or 5 months because of whiplash, muscle strain, her face all bruised.
That's unbelievable. You know, violence and aggression in the emergency room, it's unbelievable. You wouldn't understand that people might want to do that. If people are intoxicated, you know, you can kind of try to understand, even though that's not a reason for doing that. Not at all. I don't want to say that at all, but sometimes people get so high or so drunk that sometimes they don't know for sure, even though I don't think that, but it's still not a reason to do that. But I think if you go to the emergency room and you want to hit nurses and doctors and personnel, and then I think what we do here is we always have a guard. Whenever we see that somebody is drunk, we try to get it. The guards are inside the room with us. They stay there, but still, I mean, people can still hurt you, even though you have a guard, because sometimes they are so fast and yeah, you know, they hear all these stories about ERs, and then they. And sometimes you get a lot of problems. What we see a lot here is with family, you know, that comes with them, with these people that are they are more aggressive sometimes than than the patient. But what we do is we have guards almost everywhere the minute they walk in, and we have panic buttons which we carry in our pockets. We can, but still doesn't. The only thing you can do with that is getting help, but people can still hurt you.
Right.
We are,
That happened one time. We fought to get a security guard in the emergency room, and he was there. Now this was a male guard, and I brought a female patient that was just one of those that needed to have attention. I put her behind the curtain and asked her to remove her shirt. So the male guard stepped out and she went, wham! So I'm thinking, now, you know, what do we do about stuff like that? I don't have a female guard.
no, I think on an island what we do is we try to start with, like, again, in the emergency room itself, but then after that there should be a lot of information to people. You cannot do that. That will cost, might have an impact on everybody. But you know, I saw a system in Holland a while ago that they categorize people. If once you have been aggressive in the emergency room, they give you a color coded that will pop up in any electronic patient chart, and then you have to go, the patient itself. Once that's pop up, the nurse, the administrative personnel will tell you have to go to get a guard, and the guard has to come with you. If you don't come with a guard, even though you're not aggressive that day or whatever, it will always stay there. And the thing is, they even make them pay for the guard, and that worked a little. I don't know how good it worked, but that's one system that we wanted to put in our emergency room. But yes, like you already said, I left. But these are the things we were thinking about. We have panic buttons, we have guards, we try to do all the things we do, like you just said, walk backward. But sometimes put the responsibility with these people that do these things, work a little better. So I know that the hospitals that do that in Holland, they do work better. Even though you're very close to the legal thing you have there, you know, they're still patient and you still have to feed them.
Right.
But it's not nice when people get hurt like that, and it's not going to be better. That's the bad part.
No, because
That's the
you
bad
know,
part.
we become short a nurse,
Exactly.
and so now all the other nurses are working twice as hard and trying to get things done. But what we have tried to instill on everybody is to write incident reports. Make sure the hospital is aware of how many times that we get assaulted, and we also have been calling the police.
Yes, we do that too, and we do write incident reports. We do call the police. We always do call the police.
Now, do you
A lot of times they don't do much with it because they're patients and you know, it's hard
be
to do
their uncle.
something. Might be, but that's the thing. Huh? They still see them as being a victim, even though they victimize other people.
Right, right. We also bring them to court, and we try to talk to the court magistrate, then we go that long route. It almost takes a year to get it into.
Sure.
Now, just out of curiosity, there's a lot of states that have a lot of laws. You know, like in the state of Massachusetts, Governor Deval Patrick stiffened the penalties. So if somebody comes and hurts a healthcare worker, they could get a bigger fine or maybe go into jail for 90 days or something. Do you have anything like that here?
No, we don't have that.
No.
You don't have that. You can use it for general, you know, but that's true. That's the things they should do, because we are not the only ones. Social workers, people in the outside offices, first primary care physicians, you need that kind of thing. So people might be a little more
Well, for
hesitate.
us, it was another way for patient advocacy, because a lot of these folks, you know, just because you're under the influence of alcohol or you have a mental illness does not mean that you're locked up in a facility. You're out to Dunkin' Donuts, you're doing your shopping, you're doing this, you're doing that. That doesn't give you a right to change your behavior.
Sure not.
So when the system gets in place, you call the police, you go to court. The court may have another avenue, so this person can get more psychiatric help, drug and alcohol testing. And you know, when money talks, once it comes out of their pocket, you know, I mean, sometimes they get a check and they drink with that check.
You're right.
Well, now that check
Right.
is going.
Exactly.
Now, the last thing I want to say, which really bothers me terribly, is that this nurse, she's one of those nurses that is just, she's terrific. She works nights. Anybody that works nights is
That's
terrific.
good.
You know?
Yes.
Yeah. And she's very pleasant. I've never seen that she had a bad word. And she goes into a patient and she knew right away that the patient wasn't a happy person. And she walked out, and she walked out backwards like you would, but she tripped on the emergency room floor. While she's on the floor, this man got up off his stretcher, came right in front of her and kicked her in her face. Now, you have to give the nurse and the staff credit for not killing him. I mean, I
Exactly.
would feel, you know,
Yes.
not all nurses have
Yes.
been brought up with, you know, prim and proper, and, you know,
Yeah.
we've had nurses that have been brought up in the housing developments, and they know how to fight.
They
I mean,
know.
truly, and they don't. They don't fight, they don't hit their patients, and I think they ought to have a medal, because
But-
that to
But,
me,
you know, even though it doesn't matter what kind of social background you have, they can make you very mad. And especially when somebody hits you and you're there to help them, it makes you very mad.
right. Well, not only did I mean, this makes me quiver to think that somebody would get up off a stretcher and kick a nurse in the
I
face.
don't think you're sick enough to be in the ER.
No, no, it should be back in the
Exactly.
wherever. But so much has been happening, and I'm not sure what else to do. I have no other, now, your idea, or from Holland, we did a system that we could, if somebody assaulted us, if they were aggressive, it would pop up. But it got lost, and, you know, the registration didn't tell the charge nurse didn't tell the staff nurse, so, you know.
Yes, that can happen.
But I think the
But
idea.
there must be a way to do it. Now, electronically, we can do almost everything.
Right,
So it
I
must be
think the
possible.
card, and to pay for a guard
Yes.
might help.
They even made them pay for 2 guards. They need to come, even though they're not aggressive at all that day. And I know that worked, like you said, if it hit you in the pocket, it might work.
It might.
And it's not nice to see somebody walking with 2 guards everywhere you go.
That must be
and-
humiliating.
Exactly, and that's maybe the only way to get your message through. It's kind of strange that we think like that as nurses, but sometimes you get to defend yourself.
That's right. Well, I'm not sure I have any more questions, although I must have about 150 hidden in my head. But maybe I will close for now, and thank you.
Thank you.
It's great to see you again.